Dr. Hyla Cass is a renowned innovator and specialist in addiction recovery, psychiatry, and integrative medicine. She helps individuals recover from addiction and other psychiatric conditions using natural supplements. Treating the whole person, mind, body, spirit, and environment are among her principles. Another foundation of her practice is identifying the origin of the problem, then utilizing a sequence of safe and natural treatments to address it.
Hyla, thank you so much for supporting and having this conversation. I know that you are really a leader in this field, and I'm curious, what got you into this field? What's your kind of hero story here about what brought you into what you do?
Well, first of all, what I do is I am a psychiatrist who basically does not prescribe drugs as most psychiatrists do. And I leave that to other people. If that's a choice that someone has, they want to be on medication, that's their choice. But I have really specialized in the non-drug approach because what I feel is most important and what I've seen is most important is to get the body's chemistry doing what it's supposed to do. We are part of nature, and when we enroll nature to help us to restore balance, it's miraculous. It really absolutely works. And when we use medication, which is what psychiatry uses and which the addiction treatment centers use, and standard addiction treatment involves meds to get off of drugs, you're basically creating another addiction. By the same token, I am not saying never use meds, never use them in addiction, never. There are times, there's a time and a place for everything. So I'm not a never say, I'm a never say never kind of person. Mm-hmm. So if someone is in acute detox and they need some medication, fine. But I'm saying to restore balance, you want to give the body what it needs to make the neurotransmitters, which are the chemicals that go through our brain and give the messages of good mood, bad mood, whatever, and do that, which puts you back in the driver's seat, puts your body back in the driver's seat instead of being at the effect of these foreign chemicals that have so many adverse effects.
Yeah, and they essentially hijack our brain and our body from its natural state and its natural processes. So how does one approach this? Because when you say that, that sounds wonderful, but a lot of times getting there is, it's hard for people to understand, what do I do first? How do I go about this? And why is it so important to get my gut and my brain and my body aligned with its natural chemicals?
Right. Well, we can tell, first of all, by your substance of choice, whether it be sugar, caffeine, cocaine, weed, whatever it is, we can tell by that choice what it is that you're out of balance in, what you're deficient in, and then we treat accordingly. So I have a quiz. In fact, I'll be making it available as a bonus.
Thank you.
For people. And when you take the quiz, you can see right away that, for example, if you're let's say if you crave cocaine, that's your thing. Mm-hmm. What you're deficient in is dopamine. So what we want to do is raise your dopamine level. And we do that with amino acids like tyrosine, phenylalanine, and then what are called cofactors, which are vitamins and minerals that are specifically working together with the tyrosine and phenylalanine to make dopamine, which is the final common pathway. And the chemical pathway that then goes into your brain and makes this great neurochemical in a part of your brain called the nucleus accumbens. And you get this yummy feeling of reward, motivation, focus. It feels good. It's also, by the way, children and adults who have ADD are low in dopamine and they want stimulants. In fact, they're given stimulants. However, rather than giving a stimulant, my preference is to give tyrosine and phenylalanine and then throw in also some omega-3 fatty acids because the brain always needs that. The brain is made out of largely fat. By the way, that whole fat-free, cholesterol-free idea has been a disaster for people's brains. Not
Yeah,
to
it really blew up on us, didn't it?
everything. So, in fact, I have developed some products, and I'm not here to tout my products. I'm only trying to explain the concepts behind viewing. And at the time that I developed these products, there was nothing on the market. Now you can buy the individual amino acids, and I think there are probably other formulas that are not that different, but mine are tried and true. So for the dopamine push, I've always used Focus. And the Focus product actually has phenylalanine, tyrosine, something called DMAE, which is a precursor to those, as well as making acetylcholine, which is good for memory. And it has some ginkgo as well, which is good for brain blood flow. So I make these things like, it's like baking a cake. You put in all the right ingredients, and what comes out the other end is a really good cake. So what comes out is something that really will switch on your dopamine. So that's one example of what would happen with an addiction.
Okay. And so if we look at this as, supplementing with nutrients and looking at diet, is that something that one could look at and say, this will happen in a week, the transition to, what kind of time frame does it usually take for the body to rebalance itself?
I've seen it happen right away, right in my office.
Really?
Yeah. Well, I'll give someone an amino acid under their tongue and actually titrate up to get a dose that is effective right away. So that's the real joy of using amino acids. They're instant. When you get some pure, for example, this is so cool. Glutamine is one example that people can use themselves and really tell. It's something I use, glutamine, which is an amino acid that you open up the capsule, put it under your tongue. It has a kind of a sweet taste. It's not bad. It's not a yucky kind of powder, as some of them are. And if you have a craving for alcohol or sugar or really anything, like you got to have it. Even a habit, a thing that you know you shouldn't be doing, like gaming, and people are addicted to gaming or whatever they're addicted to. You open up the capsule, put it under your tongue, let it absorb, and it absolutely stops it. I mean, I had this woman send me an email saying, "What is in glutamine? I'm an alcoholic." And the other night, I was going to go out and buy some wine because I was all out. This was late at night. Like, really? But she said, so what I did was I figured I'll try it because I bought some. I didn't really believe it, but I bought some, put it under my tongue, and she said, it just went away. I just didn't even think about the alcohol anymore. So what's in it? So what's in it is glutamine. And it goes into your brain and it covers that craving. It goes to the places, to the receptor sites that are saying, feed me, give me, I want wine, or I want sugar, or I want to go out gambling, or whatever it is that you're doing that's bad, and we consider it bad, something you don't want to do, then it just does it. It takes care of it. So what I'm also saying, I said use the word bad because we're judging ourselves. Well, that's a bad habit. That's a bad thing. Well, it is. It's bad for you, actually. Mm-hmm. But rather than judging yourself, what you need to know is you have an imbalance. It's not a moral weakness. It's not there's something wrong about you. If you had more character, you wouldn't be drinking or drugging. It really is that part of you that you don't have a whole lot of control of. And at some point, what happens in a craving is that your frontal lobe, the part that makes decisions like, I'm not going to do that, that part goes to sleep. It is offline. When you have a craving, it's coming from a very primitive part of your brain. So these amino acids feed the brain at that level. So you don't even have to think about it. You just do it and your body does this miracle. Now, I'm always like, I'm a doctor. I went to medical school. And it still never fails to totally amaze me when I look at the miracles that happens at every cell, at every moment. All the reactions that happen. the complexity of it. And the more we know, the more I'm like, wow.
Yeah, we've really come from a place where we thought everything was independently in its own space, like the brain and the heart and the gut, to now we're in a place where we see it's an orchestra, right?
Yeah,
And that's what makes our life. But when the tuba is out of tune or plays the wrong note, the brain hears it, right? And it's not a good thing, but we can get that back in check. And as you're talking about using that little practice there, I mean, if you think about people who are just not even don't have an addiction, but kind of have an addiction to Coke or to sugars, as soon as you have a Coke or as soon as you have that piece of cake, or instantly you feel better. So I can understand how that would work, and it would just, your brain is open to it. And under the tongue, why under the tongue? Is that the place
because
where
it's instant.
it's instant?
That's instant.
Yeah.
You want to try something and get it working right away, you put it under your tongue.
Okay. When did you realize that the brain was kind of driving everything, and the connection between the brain and the gut? Can you go into that a little bit?
Well, I didn't discover that one, but what we do know now is that what goes on in the gut goes on in the brain. When there's gut inflammation, there's brain inflammation. And that's not my expertise, but we do know that when we have any sort of gut inflammation, which can come from allergens such as gluten, or what accompanies it really, which is the pesticide glyphosate, and many other food allergens, the what's called the tight junction opens up, the place that's supposed to keep your gut sealed, the cells sealed, so that food is broken down inside the lumen, inside the gut, and stays there until it's totally broken down and comes out through the bloodstream. Instead, it leaks out between the cells of the gut wall out into the circulation, and the body says, wow, I don't recognize that. It could be a semi-broken down piece of a molecule of dairy or gluten or oats or whatever it is that you're eating, and your body launches an attack against it, you get an immune response, and then sometimes other organs get involved. For example, you may be sensitive or allergic to or have a reaction to, or an antibody reaction to gluten, but that resembles something in the thyroid, and you end up developing thyroiditis, or goes into the brain and it works against your brain cells, and you start to have depression, anxiety, issues with memory, whatever it is in your case, whatever is happening. So what we want to do is heal the gut, start off with a hypoallergenic diet, drop all the possibly allergenic foods, or you can do a lab test. I don't rely on lab tests, so I tell people drop the top 5 allergenic foods, basically eat a plant and protein-based diet with a good amount of good fats like avocado and salmon, and drop, in fact, for a few weeks you can drop grains as well. And then eggs are allergenic for a lot of people. Actually, chicken is too. So I mean, I have a whole routine, and I'm sure you have other people talking about this. We do a full elimination diet. I actually cover it in my book, 8 Weeks to Vibrant Health, in great detail. So in 8 Weeks to Vibrant Health, you'll see what an elimination diet is, how you do it, and then you gradually reintroduce the foods one at a time. And during that time period, what people report is they can think more clearly. Aches and pains go away. Things that they had no idea were associated with their diet. And then we have to determine, well, what food was it? And we determine that by the reintroduction. So you take a new food and you wait, and they take another new food and you wait a day or two, and another new food, and you just keep adding them in. There's a little bit of a problem, and that is something called delayed food allergy response, or delayed food sensitivity. Really, it's not an allergy. So it's a little tricky, so you may have to repeat something just to be sure, but that's, I think, the best way to do it. And there's the IgG-mediated tests that you can do as well, the blood test that a number of labs do. I send some away to labs as well, but I much prefer the elimination diet. It's cheaper too.
Okay, good. And what kind of approach would a mom or a dad or a parent or a guardian of, an early teen who is starting to show um, signs that maybe he's starting to go down the pathway to addiction or is struggling with high anxiety? How do they approach nutrition and meal planning for them?
Well, it helps to do some genetic testing, or if the parents are already have that tendency, you know that exists, and that you have to be really cautious in what they eat and what nutrients you give them. You have to give them extra nutrients, is what I'm saying.
Mm-hmm.
So if a child early on is ADD, they may end up having, which is called, actually, it's part of reward deficiency syndrome, where they don't have enough dopamine. So as they get older, they're going to do dangerous behaviors, like the teenage boys who drive cars too fast and do other things that are just really reckless. There's teenage boy behavior, but then there's really reckless teenage boy behavior.
Mm-hmm.
Those kids need to be given extra tyrosine, phenylalanine, B vitamins. And I'd say my focus product would be good because it also has the cofactors, the B vitamins already built in.
Mm.
Have them be very careful with their diet. If they eat a lot of sugar and a lot of crap, and they're not eating, which will give them blood sugar swings, and not eating wholesome foods, they're not going to have the nutrients they need. So at least give them a good shake in the morning. I don't mean to shake them in the morning. Sometimes you have to do that too. Wake up.
Well,
but like a protein shake that's highly nutritious, and you can get some vegetables and some fruit in it as well, and have them drink that before school. Please do that instead of milk and cereal.
Yeah.
I mean, it's insane how our culture is the norm is breakfast cereal, this junky cereal that's made with wheat flour and sugar, no nutrients, maybe a few token nutrients added after everything has been taken out of the original product, food coloring, every chemical you can imagine. And then you add milk, and milk is highly allergenic. We're not supposed to drink milk. To use almond milk or some other, coconut milk. But milk is not on the top of my list because so many people have intolerance to it.
Yeah. How do you approach this? Is there with kids, because a lot of these shakes taste disgusting. To kids.
Oh, you got to taste. Oh, you have to get one that tastes good. You absolutely have to do that.
Have to make it taste good, right?
Yeah.
Okay.
So you have to get a powder that you just start with a powder that tastes good. Look at the ingredients. I get mine from various doctor companies, the professional companies.
Mm-hmm.
On my website, I send people to Fulvite, which is on my website, and they can choose their own protein shake. And there's a description of what's in it and so on. And sometimes I'll guide them when I think that they need a specific one. But there are a lot of good ones on the market. And when you're dealing with kids who have really specific tastes, taste should be one of the main factors there.
Yeah. How do you manage things like breakfast is great, so we've got breakfast handled. What about when we're off to school and school lunches?
Yeah. Did you talk about that with Patty? Because that's so much a Patty question.
No, I didn't talk about it with Patty. But what's your take on it? Do you want me to address it with Patty? Patty and I just talked. We didn't do an interview though.
Okay. Well, I think we need, if they're not allergic to eggs, eggs are always good. A hard-boiled egg, some veggies and nut butter, fruit. What I'm saying is don't do the bad stuff.
Yeah.
I would avoid sandwiches or use gluten-free bread.
Mm-hmm.
But even some of those grains aren't so good.
Yeah.
They're just better than the alternative. And have the kid, if possible, make their own lunch and have some choices, have some participation in it so that they can feel empowered and that they've chosen something that they actually want to eat.
Mm-hmm. Great. Super advice. What are you most excited about in the science and what is learning about the future of the brain and the gut and what we can do to essentially heal the brain and the body?
Well, that's a big topic these days. And what you need to do clearly is stop eating the bad stuff, stop eating the chemicals that are giving you leaky gut and then as a result, leaky brain, or at least an inflamed brain. Certain supplements like glutamine, that wonderful glutamine that you put under your tongue, also will help heal the gut. I mean, what's so cool about natural supplements is that they have side benefits instead of side effects. So
I love that. Can you say that again?
What I love about natural supplements is that they have side benefits rather than side effects. So you take a drug and like an SSRI, a selective serotonin reuptake inhibitor, the idea is it's targeting the serotonin receptor. Well, it's targeting the serotonin receptor, but it's also affecting dopamine. It's affecting the gut heavily because 95% of our serotonin receptors are in the gut. It's affecting the whole body, and people get terrible side effects from the SSRIs.
Is that why there's always the warning against depression and suicide with those?
Yeah, and that is a very, very serious thing. People who have never contemplated suicide ever, when they go on an SRI, particularly when the dose has just been changed, will become uncharacteristically suicidal and homicidal. And the mass shootings, I know this is disputed one way or the other. I actually wrote a Huffington Post blog about it, and then I put it on my website saying, is it drugs, not guns, that are causing the mass shootings? Now, we don't want to have guns in people's hands either, but these drugs really make people crazy. They can do that in selected people, and I've seen it. It's very, very sad. People who have never thought of suicide, when their meds are changed, or they're just when they're taken off, and when there's a change in the neurotransmitter balance, they go.
What exactly is happening? You said that
we don't actually know.
Oh, really?
But what happens when you're giving, well, for example, you're giving an SSRI, the serotonin receptors, it's pretending that there's more serotonin, serotonin than there really is. So it blocks the serotonin reuptake. The serotonin doesn't get taken back up into the cell and broken down, but it keeps bouncing around in the synapse and it keeps hitting the receptor. And each hit is like, oh, there's another serotonin molecule. There's another serotonin molecule. But what happens, this is the thing that, like, you have to keep this in mind. Your brain's really smart. The body's really smart. So if it's getting all these serotonin hits, and it's like, oh, that's not normal, it starts to shut down serotonin receptors. So when you go off the drug suddenly, you have fewer serotonin receptors.
And serotonin, just for people who don't know, does what?
Serotonin is the neurotransmitter for, it's an actual antidepressant, and it's calming. It's also good for appetite. Women.
And we naturally get serotonin hits through what? Through community? Proteins?
Yeah.
Okay.
Proteins, but you need to have a little carb with it to have it cross the blood-brain barrier.
Okay.
So you get this, but it's often not enough, and you have to add an amino acid that makes serotonin. So you were asking about the imbalance that occurs.
So you were talking about it hitting the transmitter.
So it hits and the person gets a happy signal. You stop it. You stop the SSRI suddenly. And what happens when people go into withdrawal? They feel terrible. They feel anxious. They feel like they do when they have no serotonin, because they have fewer receptors and there's less serotonin having been made because, well, brain isn't going to be making a whole lot of serotonin if it's getting a message from this antidepressant, oh, we have it handled. So you go into this serotonin dip, and that's very dangerous. That can make people suicidally depressed and actually kind of psychotic, having psychotic thinking. I spoke to one woman. In fact, she was not a patient of mine, but she was someone I knew who told me that when she was put on an SSRI, within a short time, she began to hear in her head that she needed to kill herself. And she was not a suicidal person, but like negative messages about herself. And she realized that it was the drug talking and stopped it, and that went away. But think of all the people who don't know that it's the drug talking, or it can be getting off the drug that does it. It could be raising the dose. It could be lowering the dose. Anything that does that messes with your medication or adding another medication can do that. And if you look at the shooters, all of them had that situation, the mass shooters.
Yeah.
So that is very, very scary.
You know, and you often hear from, and I hesitate to go into this, but it's an interesting observation, from people who knew the people that did the shooting, is they seemed like a normal, good person for most of the time. So I don't know if that has anything to do with it, but if you've got, I think it does, but I'm making a large assumption there. But if you look at, let's say that somebody's listening and a loved one or they themselves are on an SSRI, this isn't a recommendation to just get off of it, right?
Nope, not at all. It's a recommendation to speak to your doctor and let them know that you're having those thoughts and feelings. And what I would do if someone came to me with that, I would actually immediately add in some 5-HTP or tryptophan. Now, you don't want to take them at the exact same time because there's a risk of something called serotonin syndrome. But which I talk about in all my books, in 8 Weeks to Vibrant Health and The Addicted Brain and How to Break Free. I always mention that because it's a very important warning. Serotonin, if you mix 5-HTP or tryptophan with a medication, there's the risk of getting this syndrome. What happens is you get sweaty and hot, you get heart palpitations, get a headache, your blood pressure spikes, you feel terrible. So at that point, you obviously you just stop both of them, drink a lot of water, go to an emergency room if you need to. I've never seen a case of it actually, but it's just a warning. You shouldn't take them together. The real problem is if you take something called an MAO inhibitor antidepressant with another drug that is a serotonin reuptake inhibitor, then you can get serotonin syndrome. Not very likely with a supplement, but it's good to have the warning. It's good to know. So by the same token, doctors need to warn people when they put them on SSRIs, there is a slight chance that you will have some very negative feelings. If you ever feel like you want to kill yourself or hurt anybody else, please call me immediately. And also tell someone close to you, because they need to be protected from that. So I would gradually withdraw them then from the medication. I wouldn't just pull them off, but I'd add in the 5-HTP or tryptophan plus the cofactors, magnesium, zinc, B vitamins, and that will actually bring their serotonin level up and reduce that negative thinking, and then gradually take them off the SSRI and replace it with natural products. The other thing I'm using a lot of these days is CBD, because CBD speaks to what's called the endocannabinoid system. And that's a system that pervades the whole body. It's a messenger system. It's an adaptogenic system, the endocannabinoid system. It's in every cell. And it helps all the cells to communicate with each other. And the different systems, so the hormonal system talks to the nervous system, which talks to circulation, and the endocrine system, the hormones, and the gut. Everything is connected that way. So it's one of the connections that we didn't know about. We had no idea that there was this endocannabinoid system until the 90s. And then it was discovered amazing. By one of the main leaders in the field is a THC researcher named Professor Raphael Meshulam from Israel. And he'd been working on this for many, many years. And they finally nailed it. So there's the endocannabinoid system inside you that makes natural, just like we have THC that gets you high, we have anandamide, 2-AG, and some other what are called endocannabinoids that also make you feel good. So we're able, if we're deficient in those, we're not feeling too well. When we take CBD, which is the THC-free CBD, so we don't have the THC, which is going to make you high, but we do have the rest of the plant, which has all these amazing properties to make you feel good. So I've used that in people with withdrawal problems, with anxiety, depression, so many things, and it works right away. You just take the tincture, put it under your tongue. I mean, I have people sitting in my office practically in a panic attack, and I say, here, try this, and they take a dropper or two, a dropper, not a drop, a dropper, because mine is 500 milligrams in a whole bottle, so it's 8 milligrams in each dropper. So I give them a couple of milligrams, a couple of milliliters, which is about 16 milligrams, and let them absorb it under their tongue, and whoa, they feel like, oh, that feels better. And you can't talk someone down. Maybe you can. I don't know. I'm not so good at talking them down. I mean, it takes some time. It takes some work. This is like a no work getting them down.
Yeah.
And not panicking and feeling like, oh, I'm feeling okay. After being like hand wringing, like, oh no, this is terrible. I feel and they go, oh, this is good.
Yeah, it's really interesting because I think that the pharmaceutical companies have done a really good job at setting up different types of drugs that help in that transition to help manage the withdrawal symptoms. And I think those are appropriate at times, but I think it's
Wait. What? Can you say that again?
Yeah. There are pharmaceutical companies that are making drugs that are opiate based. You mean
like Suboxone and methadone?
Yeah, Suboxone. Yes, exactly. That are supposed to help you through the transition period and help reduce the withdrawal symptoms so that you can manage and make better decisions and so forth. But the challenge with those is they're still opiate based.
Well, the challenge with those is that they are harder to get off of than heroin and opiates. So if you want to really be addicted and really be dependent and having to get a prescription, with methadone, you have to go very often to get your methadone dose. With Suboxone, it's less often, but you end up married to the psychiatrist. I mean, you're going all the time because you need your fix. And Suboxone is supposed to be short term, but most doctors just keep people on it. And why not? You know, it's kind of like it's a business. And I hate to say that about my colleagues, but they also, I think they believe that that's what they have to do. But the truth is, I can take people off opiates by bringing them down gradually and taking CBD. And taking the CBD, because it actually facilitates the opiate receptor, makes the whole process much quicker. And it doesn't have to hurt. Addiction withdrawal does not need to hurt. And withdrawal from medication doesn't need to hurt. Now there's as you gradually withdraw, there's little bumps at the time of a transition to a lower dose, but you can also mitigate that a lot with the use of CBD. And then I'm giving all my people vitamins, minerals, amino acids, basic amino acid. I also give them my brain recovery AM and PM, which is a full-on amino acid, vitamin mineral. It has amino acids in it that hit all the different neurotransmitter receptors. Liver protection, things like herbs like silymarin or alpha-lipoic acid for the liver, which also balances blood sugar. So what I'm saying is I put together a cocktail of what would be the equivalent of 5 different products. Instead of taking a liver product, a blood sugar product, a detox product for inflammation and for inducing glutathione. It also has the alpha-lipoic, which induces glutathione, which helps to detox. So all of those are in one product called Brain Recovery AM and PM that comes like this. And again, you can get this kind of thing separately. You can buy each kind of thing separately wherever you buy your vitamins. So this is not the only thing, but I like it because it's all in one place. And when people are withdrawing, they're not so focused on taking this much of this and this much. It's really hard. So the easier I make it for them, the likelier they'll be compliant and the likelier they'll have a successful withdrawal, whether it be from a substance of abuse or a medication, because it's really all the same. Your brain doesn't even know the difference.
Mm-hmm. Can it work on all types of addictions, in your opinion? Addicted to sugar, addicted to gaming, those are the same things happen. I know fundamentally alcohol and heroin are not going to, versus gaming. Gaming is not going to have the direct impact on the body system that gaming is, or pornography. Maybe it is, maybe it isn't. I'm just assuming here, but you're not throwing.
But it hits the same areas in the brain, the reward center in the brain.
Yeah.
And then there's something, what's interesting, we know that dopamine is made in the nucleus accumbens, and that a lot of feel-good things, like driving cars too fast or doing risky behavior, raises dopamine, and the nucleus accumbens lights up. But we also know, the research has shown that with CBD, and by the way, you'll see it also shown as hemp oil extract.
Is that legal in every state now?
Yeah, so I'm going to finish that, and then I'm going to get to the legal part.
Okay.
So I don't lose my train of thought.
Sorry.
Which I just did.
I know, I'm ADD, sorry. I think something and I spit it out, so I'll be better.
So hold that thought. So the CBD actually goes to the brain and has a direct anti-inflammatory effect, and a direct effect on a lot of different neuroreceptors. And it really works beyond just the reward center, the nucleus accumbens. And so when you have a craving and you take, I said that about the glutamine,
Mm-hmm.
you can also, if you happen to have some CBD or get some, take a squirt. When I say a squirt, you go to the bottle, you pick it up, you squirt it in your mouth, and it should be 1 milliliter. You do 1 or 2 milliliters, and that should actually stop the craving. And if you take it regularly, you'll be feeling good enough that you don't have that, gotta have that other thing, because that other thing is something to make your brain feel better. So much of it is kind of almost mechanical.
Mm-hmm.
It has a psychological aspect to it.
Yes.
To try to treat the brain simply psychologically is not going to be enough, which brings up 2 other things. I'm a little ADD too, so I get creative here and I start thinking about all kinds of wonderful things.
Yeah.
So one of the thoughts I had was about PTSD, but you were also asking about legality. So I'm going to talk about PTSD and the legality of.
Yeah, we can go legality last.
Okay,
but
do legality last.
Let's go into the learning part.
Okay. So one of the issues that people have who are addicted or who have any kind of anxiety, depression, whatever it is, generally, if you look, we do, like I say, I look under the hood.
Mm-hmm.
Instead of taking the dashboard light that's on and pulling out the wire, covering it with a Band-Aid, which is what medications do, I actually look under the hood, which is I do lab tests, I ask a lot of questions, and I figure out what causes that, and then I know what to do to reverse that, to fix it. So a lot of people, whatever they come to me for, have PTSD, post-traumatic stress disorder. And so it doesn't have to be the big shell shock that you get from having been in a war zone, although that, of course, is just horrible. And these people have terrible reactivity. They'll hear a car backfire and they'll think they're back in the war zone and they'll dive to the floor. Or they end up in the middle of the night, they're choking their wife in bed because they think that they're having a very vivid dream. So on and on. So these people with PTSD is very hard to treat. And the VA has been treating them for years with antidepressants, pain medication, antipsychotic medication, tons of meds. I've heard VA patients say that they've been given like 20 medications, a whole medicine cabinet full. And when they discovered CBD, actually these ones they were speaking, they had actually discovered weed. So they had started off just smoking weed. Mm-hmm. And the combination of the THC and CBD actually is what took away their PTSD. However, I have found, and the research is showing, that it's pretty much the CBD that's doing it.
Mm-hmm.
And getting high all the time is not such a good idea. The THC level in our current supply it's pretty much bred for getting high. And so you're going to be high and not be able to function very well. Yes, you can go to a dispensary and get a very high ratio of CBD to THC, which is preferable, but I avoid that altogether. Now I know in California it is recreational, is legal, but I don't get into that at all. I simply give my patients CBD, and it really works for PTSD.
Wow.
Amazingly. What it does is it opens up, there's that whole fear in the amygdala, which is part of the limbic system, which is our emotionally reactive system.
Yeah.
And you take CBD regularly over a period of time, and it dissipates the whole fear reaction. You don't lose the memories because you want to have memories. Memories are memories. That's part of your being.
Mm-hmm.
But you do lose that intense fear, that sympathetic
High
reaction.
anxiety.
The fight or flight reaction
Mm-hmm.
that you don't want to be in fight or flight. It's very bad.
Well, you don't want to be because, and that's what really leads you to using, to fight that chronic high anxiety state, right? Because your brain is going, let's calm down here. Alcohol will do that for us, or heroin will do that for us.
Yeah.
So you're saying.
So that's like a vicious circle. You have the high anxiety because you're in fight or flight. So you're taking the product, and then if you run out, you get into an anxiety state again, and you're pursuing whatever it is your drug of choice, or you could be put on an SSRI or an antipsychotic, and then that has terrible side effects. So on and on. I mean, please, this is not the way we were meant to live. So
Yeah, we've talked
war zones aren't a way to live either. But taking the CBD actually clears the fear part in the amygdala. And they've actually done this with rats as well. So it's not, say, a placebo effect, because they actually could train the rats to be, they got them shell-shocked about something, and then they were able to undo that with the use of CBD. So very, very effective.
And we've talked a lot, we spoke to Gabor Mate and some of our other speakers, spoke a lot about trauma. And trauma, you don't have to be in a war zone to have PTSD.
Exactly.
It could be the way that your parents were arguing when you were 2 years old, which is what happened to Tucker Max. It could be one of them was trauma from a war field. He actually was killed by a sniper and was revived again. But it could be anything, right? Childhood trauma, you were in a car accident. It could be, the list goes on and on and on. And so really we're just trying to manage that trauma and that PTSD state and that high anxiety state. So that's really interesting. And again, it comes back to the connection with the body and the brain. And what we've talked about is putting things under your tongue and doing things. But you're saying naturally we can heal the brain and the body over time. So initially it's little hacks, right?
I just want to expand a little on what you were saying. It's so important that we all have trauma of some sort. And you may not even know what it is. And by using products like CBD, you don't ever have to really know what it is, because it'll clear up. You just notice that you're feeling better all the time. But another aspect of this is that many people have had traumatic brain injury. So you were describing a car accident, a war zone. These people have head injuries. People have head injuries that they don't remember that they had. They fell on the ice as a kid. They were knocked on the head by, a sibling, or they fell on their head. People have traumatic brain injury, and it looks a lot like PTSD. And in fact, they're very closely related. And in fact, the treatments are similar, because if you give high-dose fish oil and CBD, and also check the hormones on people who have this syndrome of anxiety, can't sleep, bad memories, just not comfortable, it's a very similar list of of symptoms with PTSD and traumatic brain injury or post-concussion syndrome. And that's been given a lot more respect of late. And finally, the football, NFL is looking at it. Child soccer leagues or youth soccer leagues are looking at it. So this is serious, this is important. What they actually found was when they gave some, I don't know if it was rats or mice, but poor little things, when they pre-treated them, when they pre-treated them with CBD and gave them a head injury, the ones who were pre-treated fared much better and recovered more quickly. Then when they added more afterwards, they got even better. So that's the animal model of it. But we also know that with people, if you're taking CBD regularly and you have a head injury, and I'm just conjecturing here because this isn't something that I've done any research on.
Yeah.
But if you're taking it regularly, you're protecting your brain. Just as if you take omega-3 fatty acids all the time, you're protecting your brain. And they work together synergistically, the CBD and omega-3.
And just to kind of bring it around full circle back to addiction, this all ties into addiction because many times these are the core causes that lead to addiction, correct?
Absolutely. You have to take a history that involves head injury and PTSD, always. And there are also some methods for relieving PTSD, things like EMDR, which is the eye movement treatment, EFT, which is tapping, SE, sensory experiencing, Peter Levine's work. So there are many, many trauma release methods, and I'd say that using the method combined with the CBD would be even better.
That's optimal, yeah. Well, I know that we had some technical dances starting here. Are you still okay with time? Okay, wonderful. Anything else that I should ask you that I'm not going to think of that you can help me ask you?
You were asking about the legality of CBD.
Yes.
And since it's my new favorite, and I totally love it, I carried it on my website. You just go to my website, cassmd.com/hempoil, and you'll get to
and
it.
Cass is spelled how?
Yes. cassmd.com/hempoil, one word.
Okay.
And I've kept it as hemp oil extract rather than saying CBD, although on the side you can see where it says phytocannabinoid diols. That means the cannabinoids that are in it. And it says 8 milligrams in one squirt, which is 1 milliliter, which is the amount you get when you pull it up in the bottle.
Little syringe thing.
So I call it hemp oil extract because I don't really want to say CBD online because on a federal level, believe it or not, it's still a gray area. We have medical marijuana in most states and recreational in some, but there is really an issue on the federal level. And we don't know what's going to happen. There's a farm bill right now. So if that goes through, all hemp products, which this is, will be dissociated from marijuana, which is a Schedule 1. And because it's associated, they're both from the plant Cannabis sativa. But this is from bred to be hemp, and the other is bred to have the flowers and the buds and to get high. So that's the issue. So if you see hemp oil extract, just look and see how many phytocannabinoid diols. And usually it'll say on bottles, look on a bottle when you're selecting a brand, how many milligrams are in the whole bottle. So it says 500 milligrams or 250 milligrams. It's that much is in the whole bottle. And then you have to figure out how much is in a serving. So that's another thing that you have to look for.
Okay. I wish that legislation was that easy and that threatening to opiates.
Well, the other issue, we can get to that in a minute, is that the THC has been bred to be very, very strong in the plants because people want it to get high. And so there's been a real problem with that because when you don't have enough CBD in the plant, in the weed that you're smoking, if you don't have enough CBD to mitigate it, some people are very sensitive. And even on the first time, if they're smoking very potent product, they're going to have, they can actually have a psychotic break. And this does happen. As a psychiatrist, I've heard about these cases, and I've had cases come to me who said they just felt crazy on weed. And these are people who have a very low endocannabinoid system, and that can come genetically from stress, diet, whatever. And because of the low endocannabinoid system, they couldn't neutralize the THC, and it was so high that it just wigged them out. The solution? CBD. So when we take people who are actually psychotic from CBD, the drugs aren't necessarily going to work very well. But if you give them CBD in fairly high doses, they will come around, because you're providing exactly what they need. Because this is what I mean about using nature, because we're part of nature. And if you use something that works with the body system, you have it. That's what we need to use. And when we have so-called treatment-resistant depression, it's not treatment-resistant. It's resistant to medication, because it's not a medication deficiency. It's not a Prozac deficiency. You become tranquilized, you become manageable.
Uh-oh. We lost you.
The side effects. And they don't like the side effects, and they really want to have, a better solution. And I feel that what I have to offer, and people who practice like me, is far superior. And I really wish that other physicians, psychiatrists included, would include this in their armamentarium. They'd get much better results.
Well, I can say as a loved one, and I think that loved ones who are listening would agree, is a lot of times you're told by doctors that this will fix the problem. You may not recognize your loved one. You may be a little bit different, or she may be a little bit different. But our best case scenario is we want our loved one to thrive, to live, to be themselves, to have joy in life. And the closer that we can get to that through these methods, and just continuing to question, continuing to test, and not necessarily saying yes or no, that's bad, that's good, but being open to finding out what can work and what would work and what's good for us overall, I think is the best approach here. Because we've seen where the old approach has gotten us, right?
Yeah.
Which is people who
not a good place.
Suicide are committing suicide, which is trying to cure addiction with more addictive substances. And we need a collective kind of holistic, functional approach to this.
Absolutely. And by the way, I know I talked a lot about neurochemistry and the neurotransmitters and supplements. Now, here is my Addicted Brain book, which is actually quite simple. And it spells it out, how to deal with food, alcohol, drugs, prescriptions, whatever, how to withdraw from them. And even if you're not on those, how to best optimize your brain, better living through chemistry, through natural chemistry.
Oh, wonderful. Yeah, we will definitely make that available. Okay. Thank you so much. This has been wonderful, and I feel like we just kind of got started. And
really,
we'll have more to talk about, and I'm sure, and really, really appreciate your support, and thank you for all the work that you do. I think you're definitely one of the leaders and in trying to help people be themselves and have happy lives and not be bound by the pharmaceutical shackles that are put on us, right? That lead us to devastating results.
Exactly. Well said. Thank you.
Okay. Thank you, and goodbye for now, but we'll be back again soon, I hope.
I hope so.
Okay. Thank you so much, Hyla. I really appreciate it. All right. Take care.
Take care. Ciao.
Bye-bye.